In Augusta, Maine's new governor is upping the stakes in the opioid epidemic fight.
As Attorney General, Janet Mills made it her mission to call attention to the crisis by telling us all how many people are dying of drug overdoses every year.
The numbers are staggering. In a 5-year period, the number of overdose deaths in Maine has more than doubled, from 176 in 2013 to more than 400 in 2017.
Complete numbers for 2018 aren't yet available, but in the first 6 months, the AG's office says there were 180 overdose deaths, or nearly one a day. And of those deaths, 84% of them involved at least one opioid drug. Fentanyl was involved in 61% of the deaths. Well, today, Governor Mills put the full force of her office behind an executive order aimed at cutting those numbers.
That order is aimed at giving addicts more tools to get clean and stay clean. News Center Sean Stackhouse breaks it down for us.
It's time for our state to recover and become whole once again.
That's the mission Janet Mills shared as she signed an executive order directing immediate action on the state's opioid crisis.
The time for action is now. In the past 5 years, at least 1,630 people have died from overdose.
In an effort to bring that number down, Governor Mills laid out a comprehensive plan to improve treatment, provide better access to medication, and assist Mainers in recovery. All things the governor's director of opioid response will take up.
Well, it's a down payment. It's things that we could do right now that will save lives and start the process of getting more treatment facilities.
Smith will be taking on these prevention and recovery efforts, working with multiple state agencies.
I hope by the end of the year that we would have rapid induction Suboxone available to people ready to recover in every emergency room, along with recovery coaching to assist, as well as Narcan on the way out the door.
Some of those medications will now be more readily available through the Maine Department of Corrections.
We're working with all the stakeholders to implement a medicine-assisted treatment program as a pilot to see how it works, see if individuals can recover while they're incarcerated and transition back into the community.
With the hopes that treatment inmates are given behind bars will lower their chances of going back to prison.
And if we can provide substance abuse counseling and medicine-assisted treatment while they're in, I think they can transition to the community much better.
The governor's executive order also calls for the training of 250 recovery coaches, with 10 of those working in emergency rooms across the state. In Augusta, Sean Stackhouse, News Center, Maine.
The executive order the governor signed today also calls for substance abuse disorders to be treated as chronic medical conditions. That's an effort to get rid of the stigma of addiction.